Why does everybody fall for the quick fix? It's so tempting. You are ready to see results and you want to see all the results today. I wish our world worked like that. I wish the human body worked like that. The hardest part about healthcare and trying to optimize and max out your health is the patience part. Too many times people are trying to make way too many changes, way too fast, in an attempt to see fast, easy results, and that is their biggest setback. All of these supplements, medications, injections, peptides, all of them have to be done in a controlled fashion. If you try to do too much, too fast, then we end up in a place where you're not getting the benefit of any of the supplements. Also, you're starting to get interactions with each other and starting to get side effects. So many times I see patients that come in and they're on HRT therapy, different peptide therapies, weight loss therapies, a lot of different medication supplement options, and they're having difficulty achieving the goals that they're wanting to achieve. And it's not because they are not on good medications and substances, it's that the substances are interacting with each other. And they're really not making sense with each other for trying to achieve that one goal, which typically that goal is, how can we feel better? How can we have more control over our body, our fitness, our health? That's the goal. And when we try all of these different piecemeal options that we're putting together very, very quickly, then we run into problems and we start having more side effects and not enough breakthroughs. That's why it is so important to take it slowly. It is a process. And classically, it's a 3 to 6 month process to really achieve the goals that we're looking for. I wish it was faster. I wish I had magic shots that would make it faster. But I'm telling you, for transformation, it takes 3 to 6 months. And classically, it takes between 2 or 3 different supplements, medications, injections to help you, give you the tools to make that transformation. And even once you make that transformation, it takes daily discipline and weekly discipline to ensure that you maintain that transformation. Life happens. Vacations happen. I was a perfect example. We were out on vacation for an entire week. Great time with the family. There was no gym at all. And I went an entire week without working out, which I've not done in over a year. When I got back home, yes, I had lost some muscle mass. Wasn't drastic, but I'd lost some muscle mass. I needed to regain that muscle mass, and I wanted to regain that strength that I had lost by not working out for an entire week. So I adjusted the different injections and the different peptides that I was doing to try to get back some of that strength. I'm not looking to gain that strength back in a day. Realistically, missing a week with these types of peptides and injections, I can regain it in about 1 to 2 weeks. And now I'm 2 weeks out and I have regained that strength that I lost. Without those injections, it would have taken me probably 4 to 6 weeks, at least twice as long. So yes, I am achieving faster results, but it's because I'm staying on top of a maintenance program. There's a transformation program, and then there is a maintenance program. The great thing about the maintenance program is that you can receive results a lot faster because you've already made the transformation. And now we're just going a little bit off of baseline. We had a lot of celebrations this past weekend as well. It was a lot of fun, a lot of family, a lot of friends. But because of that, whenever I got on the scale after that weekend, I was 3 pounds up. Okay, I understand that. I am not anxious about it or upset about it, but understand I'm going to take my GLP-1 microdose that I typically do once or twice a month. I'm going to increase that dose because I'm looking to try to get rid of that 2 or 3 pounds over the next week that I gained over this past weekend. I got on the scale after doing that for the first day. I had lost 0.5 pound. That's good. Small incremental changes, nothing that's drastic, but incremental changes that are lasting. That is the difference between short-term results that never last for your entire life versus long-term results that are the product of small incremental changes. So I implore you, this is why it is so important to find a wise physician who understands all of these medications and supplements and injections and peptides. It's overwhelming. There is so much out there, and I'm telling you, I wish I could explain it to everybody so everybody could understand. The reality is that it has taken me decades to get to this moment, and I'm still learning and am yielded to still learn for the betterment of my patients and for myself. It's important to find somebody that you can trust, who is an expert, who you can see and understand they're practicing what they preach. They're doing it too, and they are seeing results, so I can trust that. I tell patients no more than I tell them yes. I don't say that to brag. I say that to illustrate how we have to take it one step at a time. When we do, though, I'm telling you, 99% of the patients, they see those breakthroughs. They reach their goals in that 3 to 6 month time span. And not only do they reach them, having done this for well over 10 years now, they maintain the goals they achieved. That is probably the biggest reason for partnering with a physician who has expertise in this area. Is not to achieve that goal, it's the maintenance of that goal. If you're so focused on what you see on the scale versus the entire picture, the whole body composition and blood work and how we're feeling and how we're sleeping and our vitality, that is really what I'm looking at as an expert in this area of both traditional medicine and functional medicine. It's not just what the scale says. It's also what your labs are telling me, what your symptoms are telling me, how your vitality is going. As you give me all of that data, it informs me exactly what is the next best step for you. And then you look up after 3 or 6 months and you realize, I have experienced this body transformation and I feel great, and metabolically and hormonally I am healthy, and a lot of the things I needed to do to get here I'm able to actually come off of it now, and now I go on a maintenance regimen. And when things are slightly off, I know what tools to use, and I know the coach and the physician to go to ask for help, to layer on so that I never get back to where I was before. So remember, anytime we go on any of these healthcare journeys to try to optimize our own health and get off of a lot of these chronic medications, the goal is transformation once and then maintenance for the rest of your life. It does not help you to lose 40, 50 pounds a dozen times in your life. You actually increase your risk for heart attack, strokes, and cancers when you have that much fluctuation. What we really want is transformation and then maintenance and achieving that goal with discipline. And the frequency for the discipline is your own discipline on a weekly and monthly basis, in partnership with a great physician for discipline on a monthly and quarterly basis. That is the formula for success. And that's what I implore you to utilize in your body transformation and then body maintenance for the rest of your life.